Good morning. My name is Debbie Howard, and I'm very happy to be joining you by video for today's conference. I'd like to tell you a little bit about myself before I start. I have lived in Japan since 1985, and that was the reason I became very interested in aging in the world. Uh, First in Japan, because it's a very aged society, and also in the US, my home country. In 2007, after about 20 years of living in Japan, I was called home to South Carolina in the United States to help my mother, who was diagnosed with lung cancer. And she really needed my help. I'm the oldest daughter of three, and she really needed my help full time to the end of her life. And so I went home to serve as her caregiver, and I worked my business in Tokyo off the dining table where we had eaten dinners as a family when I was a young girl. It was a very traumatic experience and one that I was not prepared for, um, either professionally, because I'm a marketing person, not a nurse, and also not emotionally. I was actually not prepared for everything that was thrown at me and my family during that time. So it inspired me to study more about the aging phenomenon in Japan, in East Asia, in the US, and in the world. And it inspired me to uh, use my research skills to do something new and different with those in terms of what's happening with aging and what's happening with caregiving in the world. And when I say caregiving, I mean family caregiving. I mean people like you and I who are not medical professionals who end up helping our families to the ends of their lives. So let me share a few thoughts with you today. I'm very honored to be here with you. I know this is an important group and that you have lots to offer in terms of collaboration and sharing best practices. So I'm going to start by sharing my screen. Let me just put my PowerPoint up here, and we'll get it in the right mode for you. Let's see. There we go. I think that should do it. Okay, great. So I'm just going to talk a little bit about some of the things I've seen and heard over the last few years, and try to give us a broad perspective of what's going on with aging and caregiving in the world. Let me see if my slide will advance. Why won't it? Oh, maybe here. Up, there we go. Okay, so we have by the year 2030, we will have about 1 billion people who are age 65 or more in the world. That is an amazing number. It represents about 10% worldwide population. Of course, the aging phenomenon is greater and fastest in Japan right now, with 30% of the population being 65 or more by 2025, 15% in South Korea. But South Korea is estimated to be the most graying society in the entire world by, I believe, 2050, with about 50% of its population at 65 plus. Very rapid graying in South Korea, and 12% in China. And also China's aging and graying phenomenon is picking up speed very rapidly as well. That's compared to about 20% of the population in the United States. And I use the United States as a benchmark because it is one of the most rapidly aging societies, with the baby boomers at about 70 million people. And I believe that these issues of caregiving, aging and caregiving, are global. They are not separatable to one country or one region. They are the great common denominator, if you will, among our societies in the world today. And that's why many are calling caregiving itself the next global healthcare crisis. Let's just look a little bit at um, some of the impacts of aging. So it's great that we're living longer these days. Modern medicine has allowed us some great advances in society in that respect, but it also means that because we're lasting longer, we're seeing more chronic health conditions, heart disease, cancers, and of course, Alzheimer's and dementia. We are seeing the incidence of these conditions rise as our populations age. Looking at Alzheimer's and dementias is a very frightening thing, but it's also a good way for us to see the big impact that these types of things are going to have on our societies. Here we can see that Alzheimer's and dementias are increasing over time. And you can see that Asia is growing slower, at a slower rate, or let's say growing a little slower than the other countries, but still it is growing. And in fact, globally, the number of people living with dementia and Alzheimer's will increase from 50 million people today to 152 million in 2050. That's a huge increase. And if we don't find a cure for it, it's going to be a huge impact on our societies and also on our individuals who are taking care of our loved ones who have dementia and Alzheimer's. East Asia is the region with the most people living with dementia at 9.8 million. I'm not saying it's growing faster. I'm saying because of the sheer numbers in Asia, we have the most people living with dementia here. So that's a really important point to keep in mind in your discussions about best practice sharing and what we can do in our societies to make it better for those who are aging and also the caregivers who take care of them. Government and social safety nets are strained. I don't think I have to tell anyone in this room that. We all know it. It's just a question of what are we going to do about it? We are all sitting here today because we would like to talk about what can we do about it. What kinds of policies can we make? What kinds of programs can we develop that might help with this situation? One example, I'm sorry, before that, I'll just talk about public spending on the elderly. This is just shows you the magnitude of spending on aging in our societies, 22% of GDP in Japan, and darn near close to that in South Korea and China. In the United States, we say that the value of time and effort by family caregivers is equal to the annual budget of Medicare in the United States. So you can imagine the huge impacts this is having on our societies with public spending, and of course also the gap that caregivers are filling. Here's a good example in South Korea of a government effort that is supposed to come in by 2025 that will help to address some of these challenges in South Korea. So we've got everything being addressed from communal reference, I'm so sorry, from communal residences to housing for elderly couples and renovating houses, and also residences for living alone, food delivery. Everything is being considered. These types of programs and initiatives are important ones for us all to be watching on a regular basis, because it's a very fast-moving target, this aging phenomenon, and we want to be sure that we're sharing best practices. The aging phenomenon quickly gets to the home and the heart. Um, it's where the care is really taking place. If care receivers are not in assisted living or nursing homes or hospitals, then they are at home. And they are needing help from people like you and I to make sure that our loved ones are well taken care of. It's a very personal thing. And I've experienced it myself at that point in my life, 2007, 2008. I've also been a caregiver several times since then. And in fact, I'm speaking to you from Texas because I had a caregiving emergency in my own family and I needed to stay here and take care of my partner, um, who had a surgery earlier this week. He's fine, by the way. And I would like to suggest to you that about half of you sitting here in this room today will be called upon to be a caregiver, a family caregiver for one of your loved ones at some point in the next 5 years. Rosalind Carter, our former First Lady, has an Institute for Caregivers in Georgia, and she has famously said that there are only 4 kinds of people in the world: those who have been caregivers, those who are currently caregivers, those who will be caregivers, and those who will need caregivers. We do call non-professional, unpaid caregivers in the United States. In the UK and Europe, they are sometimes called carers. So you might hear that term as well. And I thought I should clarify that because I'll be using those 2 terms interchangeably throughout this presentation. One of the studies that I've found that I think is the best overall view of what's going on with caregiving in the world, and again, the aging phenomenon is integrally related to the caregiving issue, because they cannot be separated. This study is of 3,500 caregivers around the world. They are Western countries: Australia, France, Germany, Italy, Spain, the UK, and the US. It was done by an initiative called Embracing Carers that was started by Merck, which is headquartered in Germany, as a way of engaging international caregiving and care organizations to guide them in policy recommendations and innovating new ways of helping caregiving, which again helps societies and the aging phenomenon. Unfortunately, this study, which was done in October of 2017, does not include Asian countries. However, I would challenge all of you in this room to think about how you can get involved with Embracing Carers and the organizations that I'll show you later that contributed to this study, so that Asia is represented in the next study that they will do, which I would guess will be in the next year or so, considering the way research cycles work. An aging population means that caring for older or disabled loved ones is inevitable for all families. Workplace and care services must catch up with this reality of family life. That's where we are. We are in catch-up mode right now because this trend is moving. Aging and the impact on caregiving, it is a moving trend. And again, companies and care services are in catch-up mode, trying to figure out how to best support caregivers. Let's look at why. Why would they be doing that? It's because the impacts of family caregiving are huge. We have impacts on basic self-care. Um, 47% of unpaid caregivers have feelings of depression. That's very, very high. 3 in 5 have no time for exercise. Over half, well over half, find it difficult to get regular sleep, and nearly half have gained or lost weight. These are basics of self-care that every human being deserves to have, and yet these are being uh, ignored when we find ourselves in caregiving situations. The act of caregiving also impacts caregiver health, and this has ramifications for years in the future, even after caregiving is done. Over half feel their physical health has suffered. Many put the health of their care receiver above their own, and if you've ever caregiven, you know that that is almost unavoidable. And many hesitate to ask for help about their own health. So caregivers tend to put their own health on hold while they're caregiving for others. And that means that their health is going to suffer in the future as well, creating more problems for society going forward 10 and 20 years out. There are negative impacts on work, finance, and relationships. 21% feel their careers have been negatively affected by their caregiving roles. They've had to reduce their working hours to care for a family member. 30% feel caregiving has pressured their financial situation. And indeed, many find that they are impacted for the rest of their lives because they had to spend money on their parents that they will not have for themselves. And 21% feel that their family relationships have been negatively affected. This is very emotional territory. It's very highly charged. Often siblings have arguments. Even mom and dad have arguments with their kids over it. It's a very emotionally charged situation, and problems do happen. Clearly, with an aging population, becoming a caregiver-friendly workplace makes business sense. We do have some studies that show that productivity is better when workplaces find ways to be more flexible and allow employees to take care of what they need to take care of in their personal lives. We've seen it with working moms, and we're about to see it with working caregivers. I estimate that 15 to 20% of every workforce is a working caregiver at some level, maybe taking their parents to, let's say, doctor's appointments. That would be at the low end of the scale, all the way out to full-time caregiving. There's also a feeling of lack of support. About 30% feel their role as a caregiver is unrecognized by the healthcare system. 25% have had no information or practical support in the past year. 15% may feel unsupported by their families. That could be, let's say, siblings letting one person take more than another. And 17% feel unsupported by medical professionals in their roles as caregivers. That is one of the challenges is the caregiver who is seeing that care receiver on a daily basis, being involved in the healthcare team, having an active role in that healthcare team. Carers are invisible. They're hidden behind the curtain. They're among us, but we don't have the eyes to see them. Think about it. Just think about people you may know who are taking care of their parents. It's a very lonely job. If you've ever done it, you know. Some of your friends disappear. They're just not around, and you're on your own. That's what we're doing with our society and government. That's what we're doing to these caregivers who, again, are filling the gap that our healthcare systems and our governments are not filling. In China, we know that caring for family is a core part of culture and tradition. That's actually true for all East Asian cultures, and it's more so in East Asia, so for Japan, South Korea, and China, than it would be in Western countries. Western countries have a greater tendency to outsource their care, for example, to assisted living or nursing facilities. It's not that we don't care, we just have a little bit more of a tradition to use helpful services like that. But in East Asia, it's very much considered part of the responsibility and duty. So we have more at-home caregiving. And what's happening is that with an aging population, with adult children who are working full-time jobs, supporting our parents and grandparents is a huge challenge. China has addressed this in its 5-year plans. And again, I really encourage all of you in this room to look at what we're doing in Japan, in China, in South Korea, and try to share those best practices, not only in East Asia, but let's share it with the world, because we all need to be looking at all the different good ideas that are out there. So again, aging and caregiving are integrally interconnected, and it's an affair of the heart. These are real people who are experiencing real problems with aging. They need real help. And the people who are helping them, the caregivers themselves, the carers, need real help as well. Unpaid caregiving has become one of the most important social and economic policy issues worldwide. And again, as I mentioned to you, many say it is the next global healthcare crisis. We are encouraging everyone in the global community to come together, to collaborate, share best practices, and become more aware of caregivers. In this study that I just shared with you, Embracing Carers, again, an initiative of Merck and the International Alliance of Carer Organizations, IACO, and Carers Worldwide have collaborated. There are also some national organizations. This one's from the National Alliance of Caregivers, Euro Carers, Carers Australia, Carers UK, and Shanghai Roots and Shoots. There are others. These are the ones who supported that particular study that I reviewed. I challenge all of you in this room to find out the organizations in your countries and get involved with them. Encourage them to work together. Let's don't be separated in this effort, and find better ways forward. IACO and Embracing Carers aim to meet 5 objectives. You can see them here: safeguarding the health and well-being of unpaid carers, minimizing the financial burden, which is great, enabling access to user-friendly information and education, creating flexible workplace environments, and investing in research that supports evidence-informed decision-making. These are all important goals that we should all be working towards as we think about innovating new ways of supporting aging in our societies, as well as family caregiving. I think that is basically what I wanted to share with you today, and I really appreciate your time listening. I would just like to leave you with one thought, that because unpaid family caregivers are really on the front lines of providing care services, it's very important that we as policymakers and care system influencers think about them and do not take advantage of all the work that they are doing for free, by the way. Family members should be empowered to take care of their loved ones. They should be helped and supported with adequate support from formalized care systems. And I think that's why we're all here today, is to figure out how to do this better. And I really want you to consider this as a conversation starter. I would love to be part of that conversation, and I welcome the opportunity to work with you all on moving things forward in the future. I believe that is all I had to say, and I just want to stop my screen share here and say again, thank you so much for your attention, and thank you so much for attending the conference, either in person or virtually. And again, I welcome the opportunity to work with you in the future. Thank you very much.